forward, we are recording, so welcome once again. What we're going to talk about today is a little bit about HIPAA law, defining that as far as we understand it and how it pertains to the law, understanding what we need to protect as far as information, and can protect that information. The major points that we're going to be talking about today happens to be HIPAA violations and penalties, and has been recently changed with results with the advent of the new laws that in the last year for the Recovery Reinvestment Act and the HITECH Act. We'll talk about that. And then we're going to see how we can put this into play practically with regard to the work that's done. So let's see if we can do that. And without further ado, I'm going to ask, can folks talk to us about HIPAA a little bit? Now, Blair told me that there's a few extra folks in the room, so this is good. I enjoy bigger crowds. And one of the things that it's for me to do is be able to speak to bigger crowds. When it comes to HIPAA, I'd like to ask if we could get some responses in the room there, what HIPAA means to all of you. So if we can just go around the table, or if somebody wants to speak up, that'd be great. So what does HIPAA mean to you?
It's off.
It's the enactment by Congress. There's a lot of parts to it, actually, but I think what we're talking about mostly in today's class is privacy and people's protected health information, and make sure that we follow the regulations regarding that since we work with that information.
Like that. That was very good. We're going to talk about privacy today. We're going to talk about protected health information today. And that's what we're focusing on, to make sure that we understand what protected health information is, and if and when a violation occurs, how we can identify that, and keeping information private. So thank you very much. I appreciate that. The HIPAA acronym, of course, is the Health Insurance Portability and Accountability Act, which was signed by President Clinton at that time in 1996. And there's aspects to that. We set the standards for protection of healthcare information with the HIPAA law. Previously didn't exist. HIPAA also allows for the transference and continuance of healthcare should someone go from one job to the next. And hopefully it reduces fraud with regard to healthcare. So when it comes down to that, down to healthcare, this is more important laws that we have recently, obviously. And as we talk about this, the HIPAA are an important and particular agency in Washington, D.C. Can anyone tell me who oversees HIPAA law?
Department of Health and Human Services.
That's correct. Department of Health and Human Services would be the group that oversees HIPAA and tells us what to do if we have any problems, and oversees violations should they occur. And so it is that group, and we are involved with them a great deal right now here at our company, especially with the Centers for Medicare and Medicaid Services, the CMS, because of the building of our Medicare product for Medicare Advantage plans and Medicare supplement plans, which is what we're focused on. And so it is Health and Human Services who will come knocking at the door should there be an issue. So take a look at these aspects from the standpoint of summarizing them, and if we talk about setting the standards for protection of healthcare information, we're talking about privacy. At one. Continuance of health insurance, we're talking about portability, aspect number 2. And when we're reducing healthcare fraud and abuse, it's security. We're trying to make sure that all of these things are touched on with how we approach HIPAA in our offices, and I will hope the same is true in your office. So the 3 aspects of HIPAA in our idea would be privacy, portability, and security. We're focused more on privacy and security today. We'll touch on portability for just a minute. That's not our primary reasoning here. So, what do we protect? We talked about protected health information before, and we'll define that a little bit later. I'd like to ask around the room is, have any of you or any friends you might know or family, if you're willing to share, have you folks been the victim of identity theft or anything that impacts that?
Yes.
A few of us.
Okay. So, without going into too much detail, what I'd like to ask you to now focus on is, what are the ramifications of that? What did you have to go through in order to rectify situations? What kind of things came up that you had to deal with?
Police, you get all the things
Yep, that sounds like what we're talking about. I've had people in our conference rooms before and ask that question, and folks will say exactly what you said. The Social Security Administration, you have to call them to talk about what's going on with regard to your Social Security number. Credit bureaus, credit companies, the banks, and everything entailed with that. Sometimes you may have to get the DMV involved to switch your driver's license or get a new driver's license. Your medical information, obviously, is what we're going to focus on today in most cases, but all of those things are at risk should we have any problems with the information that we're protecting. And I've had people tell me that either themselves or the stories that they talk about with their friends where several years go by and they are still working on issues that come up. So one of the things that we like to think about when we're doing our jobs here is to make sure that we protect the information that we handle as if it were our own. And it's very important to us, if I'm handling somebody's data, what would happen or what would I think if this information got out? What would happen to me if my Social Security number and my bank account information got to the public? So what we're looking at today as far as information we protect. Next slide, we'll talk about portability for just a second. And when we're talking about portability, we're talking about the HIPAA law, redefining how the insurance companies and employers can apply pre-existing condition exclusions. And with the advent of HIPAA, is that the employer and thus the insurance carrier as well are in how they can apply pre-existing condition to any one particular person. So provides you opportunities to enroll in a group health plan if you lose coverage, and in those situations we're talking about some of the HIPAA special enrollment rules, such as if I were to get married, be able to take my new spouse and add her to my coverage within 30 days without any other problems regarding pre-existing condition or late penalties and that kind of thing. It's a new baby. If I have a new baby with a spouse, then we can add the baby to the plan within 30 days. So we actually take care of some special enrollment situations with regard to HIPAA law. All of its discrimination on health factors such as prior medical conditions. And the focus that we have for our individual and family plan teams is that HIPAA guarantees the ability to renew individual health insurance policies. For this, we have to have some type of proof or documentation to give somebody so that they can pass that on to the appropriate parties. And that document would be the HIPAA Certificate of Creditable Coverage. And the HIPAA certificate allows me to take this document and provide it to the new insurance company or employer to show them that I have been covered on a particular plan. The document must be issued after I've lost coverage as an active employee or after I've lost coverage under COBRA through plans. Defines who was covered under that particular plan. Talks about the start and end dates of the coverage for those individuals and indicate benefit options provided by that plan so the next insurance company can understand that they have been covered for a particular item and it's their ability to apply pre-existing condition exclusions based on that. Question 1, I have some review questions here. We're going to kind of go over this a little bit. What does HIPAA stand for? Again, the acronym is the Health Insurance, Portability, and Accountability Act. The aspects of HIPAA, again, are privacy, security. We're focused on privacy and security here today. Summation that HIPAA protects, we mentioned that we're talking about financial information, bank information, credit information. We're talking about medical, protected health information, and anything involved with that. HIPAA portability limits the ability of employers and insurance companies to exclude somebody because of pre-existing condition. So that's the gist of what we're talking about today. And as we now dig deeper into the situations that we're going to talk about, we're going to provide some definitions and some explanations, some examples of situations, and how to apply it in the workplace. First, in order to understand how it applied originally, we need to know who it applied to. That's what we call covered entities. You look at the HIPAA law, it said all covered entities must follow that law. So who are the covered entities? Well, Health and Human Services indicate they wanted to up law for the use and disclosure of any individual's health information by the covered entities. Covered entities are the insurance companies and doctors, hospitals, etc. new Recovery Reinvestment Act of 2009, there was a law, or portion of law, that amended HIPAA called the Tech Act. We'll talk about it in a minute. That new act, as part of the American Recovery Reinvestment Act, then the requirement to covered entities and consider a business associate. Business associates are folks that we office. We are business associates at the Word and Brown companies. We're not covered entities, but we're dealing with protected health information all day long. And act with the covered entities, we are considered business associates, and that's what we would consider everyone at VeloPoint in this relationship. So the covered entities that we're talking about pertain to health plans, health houses, and health providers. When we health plans, who are we talking about? Well, group plans, insurance carriers, all of our friends in places like Blue Cross Blue Shield or Anthem, Kaiser, HealthNet. Any of those groups is considered a health plan and thus is covered by HIPAA law. Health houses would be those groups who do data processing, like medical billing services, other data processing services that might handle PHI, protected health information, and health providers, doctors and hospitals. And that group also have to include people like pharmacists and dentists. I say that I love going to the pharmacy because they know who I am, they know what I do for a living, and I have a neighbor or a friend up at the front desk, and I know their story, of course, because we've chatted, obviously. I'm fun with them. There's that line that sits there at the pharmacy that says, "Stand here for patient privacy," and obviously that doesn't help with anything because you can still hear the conversation going on. And say, "Yeah, that's a great medicine, George. Take that. It's awesome." And the pharmacist will just say, "Hey, Bob, be quiet." As we go through these items here, that were originally, HIPAA law was originally focused on these folks because these are the primary entities covering the PHI, the protected health information. Well, as the new laws have come about, business associates are now in the same section. Business associates have to pay the same penalties for the same crimes. And the business associates have to make sure that we all follow HIPAA law and make it copacetic. So with that information here, business associate is a person or organization that performs any function or activity involving the use of protected health information in conjunction with the covered entities. On the screen, some things that we do for our companies here at Word and Brown. Weeds processing, that's part of the Nexus origin. This is going on all day long in all of our companies. Even with the protected health information, our agency at Word and Brown does underwriting for brokers or does pre-underwriting so that they can submit clean cases to insurance companies. And obviously financial analysis is going on all day long based on premiums collected for COBRA or premiums collected for an insurance plan. Bill organization, several of our companies within the group for billing services. Definitely applies to us, and as a result of our relationship, applies to you at VeloPoint. Okay. The HIPAA Act, the Health Information Technology for back up there. What's going on, Bob? Information Technology for Economic and Clinical Health Act did and amended HIPAA as part of the American Recovery and Reinvestment Act signed by President Obama on February 17 of 2009. Now, it gave us two things to worry about here in our companies. One was HIPAA law, to how it now applies to us, and the custody. You that of that law, when selected COBRA, who was eligible to receive it, was able to receive a 65% reduction in their COBRA premium. And because of this law, we had to go through the process of revamping system functionality and documentation to make sure it was compliant. And the branch of our company that handles that is Connexus. And that group, we did about 2 years worth of work in 6 months, where people were working 24/7, trying to get ready to make sure we could be compliant for this particular situation. So, business associates are now subject to the same civil and criminal penalties as everyone else dealing with protected health information. Other information involved that's covered by HIPAA. So, requirements as the covered entities that we mentioned previously, the group health plans, health clearances, and health providers. and the two being under the umbrella, also now have to be live same penalties and reporting processes. Now, a whole section later on that talks about the violations in reporting, because when I focus on that, I have a special section just for that. But this is the reason that we're here today. This Tech Act has changed our lives a little bit, not in the fact that we already have been following HIPAA law, but we follow it even more closely now because of the fact that we pay the same penalties. So when Word and Brown companies, that's our group, and we have 5 different companies. We have the Word and Brown General Agency. We have Choice Administrators, which is a model for health exchanges. We, as a matter of fact, have a couple of differences coming in next week that will take a less for the purposes of building health exchanges. And our Choice Administrators have been doing that since 1996. Choice Administrators, we have Connexus. We have a group called Quit that provides us online quoting software. And Healthcare Now, an online brokerage for individual and family plans, and Medicare Advantage and Medicare Supplement. Business associates. And as such, then, as we develop the relationship between BellPoint and Health Compare, we did in the sense that we're all business associates, and we're going to ask you to kind of follow the same types of processes that we do when it comes down to protecting information, and all in the same boat when it comes down to HIPAA law specific to the cover information and protection of information, and penalties. As a quick review, what are the covered entities? The covered entities are the plans, health clearinghouses, and providers. The various companies, the various agencies that people use to do medical billing and medical transcription, for example, and of course, hospitals and doctors, pharmacists, and dentists. And are we at Word and Brown a covered entity? And the answer is no. We are considered a business associate, by the way. HIPAA law is defining us. And a business associate, of course, is that group that handles protected health information in conjunction with the covered entities. And as a result of the HITECH Act, business associates and covered entities are subject to the same regulations and the penalties. Anybody have any kind of questions, comments, or concerns so far?
I think we're good.
Okay. We know you're good. That's why we're talking to you, but I just wanted to check. Okay. Let's take a look at the information covered by HIPAA or protected by HIPAA. What types of things do you normally deal with in your daily work schedule? I think would apply in this case. What types of information do you deal with that are covered by HIPAA law?
Everything, the questions that we ask for their health, talking to an underwriter, getting the bank insurance, bank information for the health plan, all that stuff.
Well, let's see what we have here as a definition for the so-called protected health information. This is a rather lengthy definition, and it is part of the written test that I mentioned earlier. And so when we talk about protected health information, it's the past, present, or future physical or mental health of any one particular person. It is the provisions of health care to that member, and past, present, or future payment for provisions of health care to that member. So this is the definition that we follow for protected health information, and it does not only apply to persons living. Law also applies to deceased persons, so we have to make sure that even though someone may have passed away, that information remains protected. So that in mind as well when you're talking to folks. I had after the discussion yesterday, and in my discussions with our Medicare folks we have here in the office, a lot of times the people making the phone calls are sons and daughters of those members about to take the Medicare supplement plans and Medicare Advantage plans, and in some cases, that's the same thing with regard to the COBRA phone calls that we get, where mom and dad might be taking care of the college student and premiums, so it may not necessarily be the person involved, or I should say the person on the phone may not be the person involved with the issue. So those are things that we'll talk about later to make sure we understand what needs to happen. Here's a different way to think about protected health information. I think it's a kind of a more simple way to look at it. It's the medical condition someone may have, the treatment they may be receiving for that medical condition, the medications they may be taking, and the payment for healthcare services. So put simply, it's have condition, they're fixing it, what I'm taking for it, how much it costs. So that's kind of a simple way to think about it. Let me say that again. It's what I have in a medical condition, how they're fixing it, what I'm taking for it, and how much it costs. So it fits that category. HIPAA regulations require us to keep that secure. Now, when it comes to identifying what is protected by HIPAA law, we have two parts of the equation. And the first part is individual identifiers. You have a...
No.
Okay. You should have something in hand that shows a list of personal identifiers, some of which are now appearing on the screen. And these are items that we consider methods by which we can identify a particular person. Name, phone number, email address, visit address. One of the more prevalent items that we use, of course, is a social security number, even a driver's license number. A plate number can identify somebody. We can go down to the DMV and get that information. Account number, medical numbers obviously pertain to a particular person. And the city. Other things that we have on that document that I passed out to everybody, or that was passed out to everybody, such as biometric identifiers, your prints, your DNA. I said yesterday that my television, when it comes to watching different shows, can be summed up by acronyms and initials like NCIS, SI, NEU, for Law and Order. All things I like to watch. I'm a junkie. And as such, one of the things they have on those shows a lot is that face recognition software that they run all the time to try and pick somebody out of a crowd. So in that sense, your photograph can identify you. Some of those things that you see on the list can be used to identify somebody. Now, I have to focus on one particular item here that's kind of in a weird category, which is city. Now, why I ask you all this question, why do we think that the HIPAA law says anything from city and below would be an identifier rather than, say, state or county? Why do we focus on city and below?
Maybe the size of the city?
You're in the right track.
Because cities are more specific than states.
That's right. The city situation could narrow things down even more than had we talked about state or county, and or country for that matter. When it comes to the situation, let me give an example of why this is important. I told you before, name, last name is pronounced Wojciechowski. I ask you, how many Wojciechoskis do you think are in the state of California? And more importantly, how many Bob Wojciechoskis are in the state of California? I'll tell you in a minute, but answer the question first.
Not many.
4.
There may be 4. Technically, there are 3 that I know of because they're all related. Uncle, my cousin, and myself. There may be another Bob Wojciechowski that I don't know about, but it's possible. Now let me ask you another question. How many Bob Wojciechowskis live in the city of Huntington Beach, California?
You?
Me. That's it. That being said, if you're using city as the identifier and we're using my name, that narrows it down to one person. Now, obviously, if I say John Smith, there are probably a few of those in Huntington Beach, California, and it would be more difficult to narrow it down, but still, we've narrowed it down to a handful rather than hundreds or thousands or tens of thousands of people. That's why the HIPAA law focuses on city as a demarcation point and below. County is fine, state is fine, city is fine. Excuse me, county is fine, state is fine, and anything above that, because we haven't narrowed it down enough to focus on any one person or small group of people. So, as a suggestion for you, I would like to suggest you keep that information handy at your desk. We get it out to people here. It's a job aid that people can use to understand what the individual identifiers are. So, next, talked about the identifiers. Well, the information that goes along with it. And for us to be in a situation where regulations are a problem, I have 2 parts of an equation. I have to have health information, one or more of the identifiers that are on that we gave you. If you have those things, then it is health information and therefore protected under HIPAA. So look at some of those things. We're talking about a medical condition plus a Social Security number. If a medical condition only on my desk, that doesn't mean anything. So paper here with the words cardiologist or kidney failure. I can use that to anybody because I don't have an identifier. However, if I have the words heart disease and a Social Security number, that's a problem. Because I can attribute it to a particular individual, or at least I can infer a particular individual has a heart problem. Medications plus a number. Patient plus email address. Anytime I have one or more identifiers plus health information, it's protected by HIPAA. Now, although, if I have a Social Security number on my desk, that's the thing to do, but I haven't violated HIPAA yet because it doesn't have any health information with it. Here's an example of a conversation that was going on. And then, as you see in the talk balloon, it says, I received a call from phone number 214-555-9900, 9900, in reference to member's bill with Methodist Cancer Research Hospital. So, the question is protected information and protected under HIPAA? And the answer is yes, because I have an identifier and the fact that I'm talking about Methodist Cancer Research Hospital. Now, it's possible the person on the phone may not have cancer, but it implies that the person at that phone number does have cancer. Is it a HIPAA violation? And my favorite answer in a lot of different regular classes is, that depends. Favorite words when talking about regulations. So the question is, if it's the mom, assured member, it is a violation, unless, of course, it happens to be a minor. In that case, it's not. But if it's mom and the member happens to be 27 or 26 or 21, it's a violation because that's an of-age person. If it's the member's wife who's authorized to hear the data, the answer is no, it's not a violation. So things that you have in hand or you should have is called our disclosure matrix. It's 4 columns worth of information, some of which have gray boxes and some have white. And what that is a document that we use to understand who information we can disclose and to whom. So that may be used later on as part of an exercise, but I wanted to bring it to your attention now so you can kind of start looking at it as we proceed. Now, everyone has occasionally, or on occasion, used a little post-sticky note to take a quick jot down of information when you're on the phone. I do all the time, and it's mostly because I'm about to walk out to another conference room or another part of the building or talk to some other people in the office or off to a client meeting, something like that. So, here we have of that situation. And as you see on the screen, it says, please call John Smith at 817-555-5512, and it has Social Security number. Would it be bad practice to leave the Social Security number out? That is, of course it is. We leave a Social Security number out. Don't worry about that in the sense of a HIPAA violation, but we considered a security incident and bad practice. Don't leave a Social Security number laying out on my desk for everyone to see. So we do it, but it's not a HIPAA violation just yet because all I have are personal identifiers. Let's look at the same situation with the addition of a little bit more information. A sticky note that says, please call Amy Brighton at 817-555-5512 with the security number, and now the words regarding her dialysis treatment. So now, problem with regard to HIPAA, because it indicated health information at this point. This is protected, yes, because it's now protected health information by adding health data to the individual identifiers. HIPAA violation. And it will also constitute a security incident. Security incident is the lower level of problems where I don't have any health information attached, but I've allowed private information to be released. If I have information, now it's a HIPAA problem. We never want to put any of this on our desk, and we'll talk about some ways that we keep this information protected a few slides down the road. What I'd like to do now is kind of get through a little bit of a game here. And what we're going to do is I'm going to put some things up on the screen for you to look at, and what you folks should do is tell me whether or not we have protected health information, individual identifiers, or neither, based on the previous slides that we've talked about just now. As an example, here I have the word acupuncture. Do I have protected information, an identifier, or neither?
Neither.
Neither is right. Got the idea already. You, a person who works up there with you named Aaron. I have one who works for me, and this is for my buddy Aaron in Texas, my colleague, one of the trainers out there. Yeah, we were picking on him when we put this together. And now I have Aaron picked up his Prozac at CVS. Do I have protected health information, individual identifier, or neither?
Yes.
I is right. We have a name. I have the fact that he takes Prozac. It's at CVS. Now, we don't know what CVS, but what if it's my neighbor Aaron who goes to the CVS across the street from me? Then I know who that is. So this is protected health information because I have an identifier, medication, and I even have the location where he picks it up. So the idea, let's proceed through some of these. On this I have an email address, jlowry@gap.net. Do I have PHI, identifier, either?
Identifier.
That's right. Put up this, heart disease. What do I have here? Is correct. What do I add this? I've got PHI, that's correct. We have an identifier plus health information. Out this one, I've got an account number. What does that do for me?
Identifier.
It's to identify somebody, that's right. What I got?
PHI.
Correct. Claim received for hormone replacement therapy pertains to this account number. That means now I've got an identifier and health information that I can attach to it. So it is protected. Multiple sclerosis. What do I got here? That's correct. How about if I add the word child? That also is nothing. Sad, of course, that we have a child with multiple sclerosis, but I don't know who that is. I attribute the multiple sclerosis to anybody, so we have neither here. What do we have, Mr. Bill Henry? We've identified somebody, that's correct. How about a phone number? It's an identifier. We don't have PHI just yet. I put this next item up there.
PHI.
Now I've got PHI because I have his name and his phone number, the individual identifiers, and I also know that he pays $25 copay for an allergy medication. Remember, the definition for protected health information is past, present, or future physical or mental health, purposes of health care, and payment, past or future, for the provisions of health care. This now is protected. How about Wyoming?
Nothing.
That's nothing. Is anybody in the office there from Wyoming?
No.
Oh, okay. I thought I'd ask. We just have a state. Nothing going on. What if I put 50-minute treatment?
Nothing.
Nothing. If I put a phone number? Then it falls into a gray area. What if it's just a 50-minute spa treatment? That would be nothing. What if it was a 50-minute chemotherapy treatment? Right. So that's the situation that we come into here when we get into the gray areas. Even this doesn't necessarily say we're talking about a healthcare treatment. We'd be wary of the fact that there's information on our desk that could be health information. I don't want to cross that boundary. So this is in that gray area. So what does PHI stand for? That's protected health information. Once again, as I just said, the PHI is defined as past, present, or future physical or mental health, provisions of health care, and past, present, or future payment for the provisions of health care to persons living or deceased. The examples of PHI, the two parts of the equation that we talked about. We're talking about identifiers plus health. So we're protected by HIPAA. We need things like medical record numbers and diagnosis. We need phone numbers and medication. We need social security number, premium payment. Those are the types of things that are protected by PHI. I have to have both parts of that equation. Examples of the individual identifiers, we talked about those: email, name, address, phone number. Biometric identifiers like fingerprints and DNA. All that falls into the category. And as we haven't gotten into it yet, but we will, do we treat E or electronic PHI the same as PHI on a piece of paper? And there the answer is absolutely. And I even go as far as to say we probably are more protective of the electronic PHI that we have in our system than we are of the documentation we may have on a piece of paper. You're out there trying to hack into systems all the time. We have somebody whose sole responsibility it is for our company to do that, to see that systems remain safe. But we do treat electronic PHI the same as paper PHI. For a couple of things here, and then we'll take a break in about 15 minutes. About keeping information secure. Let me ask you folks what you do to keep your information secure from the purpose of what you have access to do. I don't necessarily mean setting up computer firewalls and virus things in the system and hack-proof items. Just in general, what types of security do you have in place for yourselves as part of your daily administration?
Locking your computer when you walk away from your desk.
Okay.
Same things on the printer.
Don't leave things on the printer. What else?
Locking up your files.
Lock up files? Yep, you're on the right track. Here's what we do here at Word & Brown Companies, whether it's this office or our facility in Irving, Texas, or our outlying sales offices. Locking desk drawers is important. If to right now physically reach over to my desk 2 feet away and try to open the door, or the drawer, I will not be able to. Even if I'm sitting here at my desk, my drawers are locked. I follow the same idea that they have in the airline industry when from the flight deck says, the seatbelt sign is off. When you're sitting down, keep your seatbelt fastened in the event of unexpected turbulence, just like we do here on the flight deck. I hear it all the time, number one. Number two, I'm also a pilot. So when it comes down to locking the drawers, I think about that. I'm sitting here next to my drawer. It's locked. It's away all the time, and if you need to go in something, I'll open it, get it locked again. And if I do have to get up and get out of the way, whether it's for an intended purpose or an unintended purpose, fire drill or the fire alarm, I know desk drawers are locked. Locking the computer. Everybody does that here at this office. And we want to make sure that you folks follow the same thing, whether it's your personal computer at home or your computer at the office. It doesn't just apply here. It applies to your personal information as well. So when I get up, I quickly hit the Windows logo on my keyboard and hold it and press letter L. It will lock my keyboard for me. Or you can use the old Control-Alt-Delete. Same thing. And getting up for 1 minute or an hour. Lock my keyboard. I actually use a company laptop, so it comes with me most times, so I don't have to worry about that much. But if I'm stepping away, I'm going to lock the keyboard. Clean desk policy, that we hold near and dear to our hearts here. They keep all information off of our desks where and when we can, unless we're actively using it. In the event that I'm actually putting something in the system, in the client file or updating data, I'll desk so I can refer to it, but I won't there with it. I will lock up. Or we also have filing cabinets that we can lock with, which are in locked rooms. Okay. Pick up and out faxes and confirmations from the computers and fax machines and the copiers. It's what we really watch out for here, because obviously if we're printing something out and about it, that's sitting there overnight. Somebody from the cleaning crew can come in and grab that, although the people that work with the building and work as vendors for our company have non-disclosure agreements. That won't happen. So we pick up the printouts and faxes right away. Try not to leave them there for any length of time. Especially true if we're going to lunch, for example. I'm not going to go to lunch and leave the printout. I probably won't even go to the room and leave the print on the printer before I pick it up. We all shred once we are done with them. So we have boxes throughout our building where we documents we have shredded. Those boxes are locked, and the people who have access to them are the group that comes in to remove the material and shred them in the truck outside. The present company can't even get in there. It's like a box. Once you put the envelope in the mailbox, that's it. It belongs to the U.S. Postal Service until it reaches its recipient. Same with the shredding here. And with the shredding, I recommend for your home use that you do not use a shredder that turns it into strips, because it has the time, energy, and patience that can put those strips back together to make a document. Using a shredder for the home office would suggest using the crosscut method of shredding. A machine does that, which produces more like confetti than strips. Emails or encrypting any electronic data that contain PHI is something important. We have an automated function here that does that. If I place a specific code in the subject line of the email is encrypted. We have our computers set so that we have several firewalls in place. We have different virus things in place. We have other things that we use on the computer to make sure that they're not hacked. Curiosity, did any of you folks have any problems with that virus in the last month? The subject line said, "Here you have." Nope. Lucky you. We are having a problem with that one here at this office and had to revamp the email system to make sure that we got rid of those. Don't share cases with others. And when I say cases, what I mean is don't share with others in that you're using the information from a phone call or what documented in the system, thing like that. Cases is a term that we use here for one of our companies that talks about a way that we make notations for the phone calls that come in or how we handle a situation or what we do administratively. So the idea is if you're sitting in the lunchroom and you're having a conversation with your coworker, you don't want to share that information. You know who's listening or who could hear it. Technically, you shouldn't even be sharing information with your coworker unless it has to do with the job. I sent off an email to Blair yesterday with a document that refers to what is called the minimum necessary standard based on HIPAA law. And the minimum necessary standard, basically put, says that we should only share that information necessary for the purpose of the business transaction. So if I'm talking to my boss and I give him his advice on a situation, I say that John Smith from Pittsburgh, Pennsylvania, called me about his heart disease and wanted to know if his eligibility has been made active under COBRA. He got the heart disease in the Pittsburgh, Pennsylvania, nor the guy's name. And I was that with him. What I would say is he'd call from a person who asked about their eligibility. It's generic in that situation. It's true when you go home and talk to the significant other or the kids. Those conversations happen all the time, I hope, where you'll come home and say, "I just heard about the day that I had," and start talking about what was going on. Same thing. You don't want to share with your significant other or your kids that I talked to John Smith from Pittsburgh, Pennsylvania about his heart disease. Bad thing. Or just don't share the information, obviously. Visitors. Another method by which we keep information secure. If I look up from my cubicle and see someone I don't recognize, I'm going to ask them their business. I'm going to ask why they're around. Maybe they don't have business being where they are. What we do is we get visitors to go to the reception area first, and if they're not there, we escort them to the reception area so that they can make contact first, sign in as a visitor, and who we see, we ask that person to come over and escort the visitor. In case, I'll give you a personal example. My brother had vacation last week and joined me for a trip to my Dallas office, Texas. And I actually took him on a tour the first day we were there, walked him around, before I walked in the building. I explained to him what our company does. I explained to him the information that we handle. I explained to him that anything he may see or hear must remain confidential. He gives it to anybody. And then, desk in the lobby, he signs in and gets a visitor's badge. Walk around the building. So that's how we do things here. And it comes to getting into your work area, I have security access where you swipe your badge in front of it. It's electromagnetic security access. And I swipe your badge in front of that by the door. It'll open the door if I have access, or it does not open the door if I don't. What we're talking about here is something called tailgating or piggybacking. You open your door, however you do it at your office, and then you hold the door open for somebody else, which I'm apt to do. I'll be nice and be a nice guy and hold the door open. Hope. And someone with their badge, that's not a thing. For even our company president has to follow this stuff, and I'll hold the door open for him, and he'll say, "You're testing me, Bob, aren't you?" And I'll say, "Yes." So he swipes his badge before he walks in the door that I've got open already. And so we want to make sure that whatever security method you have, whether it's a punch code or electronic access, or you have an electromagnetic strip on your badge that you put into the machine identifies you, or maybe even more sophisticated than we are, and you've got fingerprint or retinal scanning identification. What is the situation? If you enter the door, you want to make sure that you have access to the security system to make sure you can get in there. Somebody who doesn't can't. Anybody have any questions about this information I've discussed on this slide?
Nope.
Okay. Just curiosity, how do you folks access your offices? Is it electromagnetic, or is it a code, or what do you folks do?
Electromagnetic.
Cool. All right. Talking about electronic information, here we have an idea regarding the electronic PI, where, of course, we want to keep that as protected or even more protected as paper documents, because people out there are trying to hack computers nowadays. And I mentioned yesterday in the class, Mike has a saying that he gives me all the time and reminds me to say that locks are for honest people. And if somebody is determined and really want to get into the computer system and hack it, they're going to do whatever they can to do that. We'll take whatever steps we can to try and prevent that from happening, but it's never 100% protected, obviously, because there are people out there trying to hack systems, and that's their soul in life in some things, I think. So when it comes to the electronic version of PHI, we do what we can to keep it protected within the system and pretend we distribute it outside the system. The system, obviously, we have firewalls and encryption. And in emails, we also have encryption methods. So I invite you to think about that from your perspective and what it is that you do to keep information protected within your system and when it's distributed. Here's a quick example. This is actually not protected if I were to send it. This is just a quick email that I set up from my email box as an example and pasted a screenshot in. What you see up at the top, we have the red box that outlines the subject. It says, regarding claim information for Social Security number 555, etc., for John Doe. I will send this with the encryption code. Even if I put the encryption code up in the subject line, the subject line is not encrypted, so I have to be aware of that, which is a system situation here in my office. And I understand that this won't be encrypted at the subject line, but in the body of the email. So what to think about? I have to make sure I don't put any identifiers or PHI in the subject line. So what you folks need to worry about is however that works in your perspective for your group. Okay, I wanted to show our system to someone. I'd print a screenshot out and maybe do a training presentation, and I make sure that I have protected information. So his name, account number, Social Security, date of birth, and city. Taken all the steps to protect the information. Well, the answer is not quite. If I put this box over Baker, the name Baker now protected the information. Kind of reminds me of what you see in the CIA all the time when they're redacting all those letters after they release them. They got the black lines through everything. So it's this idea. We want to make sure that we have the system protected and the information that we're showing protected. Well, about this slide, and then we'll take a quick break. And the consequences I'm talking about aren't necessarily penalties from the government or from the government. The consequences that I'd like to discuss, what I like to call the intangibles, things that sometimes people aren't thinking about when it comes to violating a law, and especially the HIPAA here. What would be the consequences for our clients? Well, in their situation, they could be levied with violations and fines. They could have lawsuits filed against them and lose their reputation. Those are some things that could happen for the clients in the sense that if they violate HIPAA, or if I were to violate HIPAA and our client had problems with that, they could have trouble even though I've done the thing versus them. So reputation is a big thing. For members, the insured policyholders, identity fraud could be an issue, and we're disclosing information of theirs without their consent. So we have to keep doing all that stuff and make sure that we do not disclose information without their consent. For our company, and I think that this would fall under your company's guidelines as well, violations could be applied, fines could be applied. Because of our violations and lack of attention, we could lose clients. That all translates to lost revenue, which translates to the company closing doors. Reputation also falls under that category. You know, for reputation is very important for me personally, for our company. And if somebody out there in my company is violating HIPAA, I violated HIPAA. So it's one of those things that I'm wary of personally, and everyone in our company is wary of, to maintain the highest standards of service for our company, the highest standards of security, and highest reputation possible. And as a side note, I mentioned yesterday, I've been working in healthcare administration and health insurance for almost 25 years now, and a lot of people out there who, if they don't know me, they know my name and have worked with me in the past or know what I do. And if all of a sudden they find out I'm associated with a company who's violating HIPAA, my reputation goes down the drain just as much as the company's. So I avoid that. And then me personally, as an employee here, we have sanction policies for our employees in the event that HIPAA is violated. We'd be written up in our performance reviews. We could have the sanctions levied against us, up to and including termination. Potential charges also apply nowadays with the new laws. It's not just the company that's in trouble, it's the person. So as you see here, we tried to about some of the things that apply to consequences should we violate HIPAA or any other law for that matter that don't necessarily pertain to the penal government. We're talking about what other things are impacting the situation should the law be violated and we have difficulties. Does it have any questions?
Nope.
Okay, at this point I'd like to take a break. Come back at about, it's 9:32 almost. Let's come back at about, say, 9:45, and we'll continue the discussion.
Okay.
So go ahead and leave the presentation active. Leave the phone on. You can just mute it, and then we'll be back at 9:45.
Okay.
Thanks, folks. Bob, are you there? Yes, sir. Hey, this is Blair. Hey, I just quick question.
you were recording this, right?
Yes, sir.
And you're going to be able to shoot us a link or something like that?
That's correct.
Okay, great. All right, so I think everybody's getting back here, and probably another 60 seconds, everybody will be here.
No problem at all.
Looks like everybody's back.
Welcome back. I hope you had a chance to get some liquid refreshment. I know I did. I got myself a little bit of coffee in the cup there, so that way we can all stay awake. All right. To last section, list ways we can keep protected health information safe. Well, we talked about that, locking the desk drawers, locking the computers when we walk away, picking up the printers and faxes and confirmation pages, shredding things, etc. So let's can think about doing that. Okay for me to share information with my supervisor or coworker if I need help with it? Yes, it is, as long as I apply what is called the minimum necessary standard, which you see as a question later on. Is it okay to share information with my supervisor or coworker for any other reason?
No.
Absolutely. And based on the minimum necessary standard, that is where I can share information to the extent that is necessary for me to get the job done. I have to overshare. So as the example and the reminder, I can go to my boss and say, I had this gentleman that I spoke with. He was worried about his eligibility for his insurance plan. Go see his doctor today. I can talk about that and ask the boss what he wants me to do with the file. I can give anything up as far as protected health information or anything over what is the minimum necessary standard. Obviously, I wouldn't want to have a conversation with a coworker in the lounge saying, I talked to John Smith in Pittsburgh, Pennsylvania today about his kidney disease and he needs his medications today and he doesn't have any insurance card and that kind of stuff. So we don't have to go that far. It's okay to send emails that contain protected information, and the answer is yes, as long as we have some method of encryption. Disclosure will be our next conversation, just rules of engagement in the military. When we talk about rules of disclosure, we're talking about, first, what is disclosure and how can you disclose? Disclosure, as far as that goes, it means the release or transfer provision of access to information, especially protected health information, to people who are not members of our own workforce. And because I usually talk to Word and Brown folks, that's why Word and Brown is up there. So you can take Word and Brown and put the word Bella Point in. So when it comes to releasing the information, it's giving it to anybody outside the building. As we talk that, we all remind everyone that we'll have individual rights under HIPAA, and these include access to or amend your information. But I can't keep your information from you. You keep my information from me. So we got yesterday the chance to go into the doctor's office, for example, and if you wanted to see your medical records, the doctor's office should print you your medical records so that you can review them. Now, I'm not talking about having the medical records copied so that you can take them elsewhere. I think if you asked the doctor to show you your medical records, they should do it. Now, in fact, you do have your records transferred from one facility to another. What I would recommend, as we discussed yesterday with the folks in the room, is that you ask the medical professional to do that for you. Because in most cases, they will charge what they call a copy records fee. And when doing that kind of business, it was $25 a pop. So what I would suggest, if you have to go from your primary care physician to a specialist, or if you've chosen a new primary care physician to go to, ask that doctor to request the material from your former primary care physician. That way they have to cut out between themselves and you don't get charged for it. You have to obtain an accounting of disclosures information. If somebody has been providing your protected health information elsewhere, you have the right to ask how and why it's being done. We also have the right to use this in disclosure of our information. I can tell the doctor, I don't want anybody outside this building to see this document. And we have to receive a privacy notice to show so that we know how any particular company or entity practice privacy and protection. When you go to the doctor's office, for example, they probably have one on the wall now. If you go to a website, you'll find a privacy notice on a website. This is actually something that we do here as part of Group Texas, that we offer the services of providing privacy notices on behalf of the employers that hire us. So these rights are the HIPAA law, and everyone has the same rights. When it comes to disclosure, we have two steps that we think about. Step one is we want to identify the person and on what their relationship is to that information. So ask them, may I verify your name, date of birth, address, phone number, and confirm 4 digits of your social security number. This is information that we have on hand that we can use to try and identify the person on the phone. Now, as I said earlier, Mara always told me locks are for honest people, and in most cases, if someone get a hold of us and wants to take information and they're good at it, the person who's on the phone isn't quite on what's going on, and it could happen. But what we do is get as many items identified as possible so that we can have some relative assurance that the person on the phone is who they say they are. Like 100% protection, but at least the more information we can get, the better off we'll probably be that that's who's on the phone. I like the fingerprints. If you look at some of those TV shows or documentaries where they're checking fingerprints and they say, oh, it's a 3-point match. Well, that's probably who that is, but it isn't necessarily be as accurate as a 10-point match. If it's a 10-point match, that's probably you. If DNA, it's probably you. Same thing here. We've got 1, 2, 3, 4, 5 or 6 bits of data that we're trying to ask about. If I ask, can you confirm your name and give me a name? If they give me all of this information, chances are that's probably who's on the phone. It's our practice here in this office. It's not a requirement. This is what we do for best practice to make sure that we can eliminate or at least minimize the risk of giving information out that shouldn't be given. So one is to identify who we're talking to. Step is to find out what they are authorized to know. What calls me up is I would like to get information about this person. Well, on that account, Blair's not an authorized contact. I tell him, sorry. That could happen with a lot of other things too that we call phishing or vishing, social engineering, where somebody who is on the phone who is very confident and very capable of what they're talking about and what they're doing. For example, they could say, "Hey, I'm Blair with Bella Point from their Beaverton office. My system is down. Can you do me look this up and let me have this information?" If the person is convincing enough on the phone, they may provide that information. Who knows? They're whose sole job it is to do that. They sit there and do what they can to try and grab information for whatever purpose they want to use it for. So you have to be careful who's on the phone. Otherwise, to know. Now, when it comes to authorization, we have several ways to deal with that in our office. In our computer system, in one case, we have a checkbox that says HIPAA authorized, and if we know that that person is designated as an authorized person, we'll check that box off so that we can talk to that person as long as we identify them. If someone calls up on the phone who's a member, and we did this before where maybe it's the daughter or the son of the intended Medicare recipient or the intended insured who's calling. Maybe it's those calling on behalf of the college student we're paying the COBRA premium. We have authorization to talk to that person if it's dealing with protected health information. So that sense happens all the time where somebody, for example, is at the emergency room and they're in a real accident and they want to call to confirm coverage. So what that person will do is call our offices to double check that COBRA is activated. They'll ask us whether or not they can provide information to the hospital representative or ER representative or whatever. And so what we can do is we can put the primary insured on the phone and they say, yes, I authorize you to speak with this person at the hospital. And they'll put the person on the phone and we can give them the information. But that authorization, the verbal authorization, is valid only for that phone call on that day. If ongoing disclosure, what we would recommend is that the member is a form that we can provide indicating who is authorized to receive their data and what data they're authorized to receive. Or they can give us a letter, or also give us a medical power of attorney. We know I can talk to lawyer John or whoever. I have an example that I dealt with earlier on in life here at the Word & Brown Companies for our group called Connexus, where I was some phone calls that day on our client services line and our participant services line, where I called from a social worker here in the city of Santa Ana in Orange County, asking if they could pay for the premiums for a specific member who was now incapacitated. And COBRA law, as far as it's concerned, doesn't matter who pays as long as it gets paid with regard to premium. So we explained to her that that's not a problem. As long as they can provide a payment, that would be an issue. And I asked about whether or not she could do business on behalf of that person, and I said, well, as long as you have either some written authorization from that person or a medical power of attorney from that person to do their business, you submit a copy of that to us, and we can be glad to talk to you about anything you need. But if that's not on file, you can't. So when it comes to information that you're dealing with, you want to ensure that you have some type of authorization on file to deal with someone other than the primary insured or the account member or holder or whatever you might use as a term. So disclose information to employers or brokers or anybody other than the member can only disclose to authorized contacts. That's the bottom line. Let's discuss some of those phone calls. In most cases, when we're doing things here, we have phone recordings that we use as illustrations. Whether scripted sample calls or actual phone calls, we'll pull them out. But because we're at long distance here, I'm not going to bother with that. But what I would like to do is ask you folks if you could provide any examples of the phone calls you might get in your daily work that could apply here and how you handle them and what kind of information is going back and forth. So let me hear from you and tell me what kind of things you deal with.
Mainly deal with people looking for health insurance where we have to get what their pre-existing conditions are and everything to figure out which plan is best for them.
Sure.
On a new client basis.
And we had a discussion yesterday about talking to those folks who were giving that information and us asking of it. And the question that was asked yesterday was, can we ask the person about that information? And the answer is yes, you can ask. The question will be, are they willing to give it to you? And so if they do give it to you, at that point now, we have to be wary of protecting that data. In addition, if they offer volunteer information, obviously you can't control what they give us. But if that information is given, then of course it's now incumbent upon us to make sure that we protect it. So some of the phone calls that we have as samples that we do 3 different phone calls, recordings here that are scripted in most cases. And the kind of phone calls that we're talking about would be somebody who calls up and says, I want to make sure that my daughter is listed on the coverage and updated. The question is, can we talk to mom about the daughter, number one? And the answer is, that depends. And the question is, can we provide information about the daughter to mom? Another phone call that we get is, just like I said before, we have a dude who's frantic in the emergency room asking for us to give information out to the hospital. And so in that case, it was a situation where, did we go through the steps to verify who this person was and document that appropriately? The third phone call is what we call peer-to-peer transfer. Someone calls up and talks to John Smith, and they ask John Smith to transfer him to Judy Smith because who they were talking to yesterday. The question is, did Judy Smith identify who was on the phone? And then the second example where she's talking to Judy Smith, we know that she didn't identify, so we can't assume that the procedure was done if it was transferred to you. If a phone call transferred to you, you got to make sure and do the job to identify that person, whether or not it was transferred from somebody else in the office. So those are the kind of phone calls that we talk about here, where things come up and things get frantic and things get kind of heavy on the phone, where we're dealing with emergency rooms or hospitals and things like that in our business. We still have to go through the process of making sure we identify who is on the phone, so we're not disclosing information we shouldn't disclose. All right, now you should have a form, and I'm going to actually take a PowerPoint here for a second. You should have a form that looks like this with you folks. It's a exercise. What for all of you to do is to break up into pairs of two, so discuss, and utilize the disclosure matrix that was also handed out, hopefully. And go ahead and fill in these blanks on these four scenarios, and then talk about this together in about 5 minutes. Take a couple more minutes, folks, and we'll get back together in about 2 minutes. Buddy, go ahead and finish up the spot that you're on, and we'll get back together and talk about this as a group.
Okay. We're ready.
Okay. Scenario number 1 says James works for the Miller Fabric Company, and he is not the designated contact for the company, but a member of Human Resources Department. And James is requesting some information about a health essay for a particular participant. So can I give him that information?
No.
That's a good answer, because we don't have him as an authorized person. If he is unauthorized to receive it, he shouldn't get it. And even if he says he's the president of the company, if I don't know who he is, I'm not going to talk to him. That's the same thing about my own company president. If I can't verify that he's authorized to have information, I'm not going to give it to him. So it's important to make sure that we determine who is authorized to hear what, and then what information they are authorized to hear. Let's take a look at scenario number 2. It says Earl is a participant services representative. He receives a call from Jill asking to verify the status of a claim that her husband submitted. Earl verifies that Jill is a covered dependent on the plan and provides her with the following information, which is claim was received, was approved, payment been sent. Is that okay as far as disclosure of information?
Yes.
Absolutely. If you look at the disclosure matrix, it shows that the only thing that we can't give out with regard to husband and wife pair, so to speak, would be a specific diagnosis. We have to make sure that the person is authorized to hear it. Otherwise, if we have Jill calling in and we can confirm that she's on the account, we can give her the fact that the claim was received and approved and paid. In addition, we're not giving anything out that's specific either. So that's a problem. That's okay. Scenario number 3. G is an FSA participant, flexible spending. He contacts the call center regarding a claim. The participant services representative verifies that Jimmy is the covered employee. Here's the rest of the conversation, or here's the rest of the story, as Paul Harvey used to say. Jimmy says, I need to find out some information for a claim that I faxed over last month. Joe says, I can help you. What's the number? Jimmy replies, the claim number is 5932. I need to know what the date of service is for this claim. And Joe then says, okay, here it is, claim 5932 for your wife's ultrasound. I have the date of service as 2/1/09. What do folks think about that?
Not good, because he said wife's ultrasound.
Very good. Now, even if he was authorized to know that or already knew it, we don't know that. Maybe his wife hasn't told him that he's pregnant or has an illness that required to have an ultrasound. It's not our job to disclose that information. why we put that in here. So number 4, Zoe is Participant Services Representative. She receives a call from Maya asking if her daughter has been updated on her coverage. Zoe verifies Maya's identity and finds that Maya's daughter is not updated on the coverage. She advises Maya to send in a request in writing to have her daughter updated on that account. Was it okay for Zoe to give Maya the information about the daughter?
We think that depends on whether the daughter is a minor or not.
Very good. My favorite 2 words I told you, that depends. If it's a minor daughter, then she can talk to mom. If it's not, then she can't. And as a reminder, the new health reform has already taken effect for dates after December 23 of this year, that dependents are allowed to remain at 26 years of age. So we keep in mind that we could be talking to an of-age dependent in the event that mom and dad kept that person on the policy. So something to be wary of. Okay, well done on the disclosure exercise. Let's go back to our presentation here. And we'll talk about how we document a disclosure, or how we document anything that we do. One is that we do perform any situation is to make it in the file, whether on a phone call that's come in or some type of administrative work that we're doing about that file or on that file, that we have a record of it. Sessions with anybody, clients, brokers, members, must be documented in the system, in writing somehow, and stored in a secured file. And that includes anytime we disclose protected health information, take a phone call, receive an email, interact with anybody. And that's practice here. We make a for anything that happens. And the HIPAA regulations require that we leave out any protected health information when we do document that action. As some examples, let's take a look at how we might document a particular situation. Here is text that we pull from a file, created to look at a file. It shows that John Smith wrote this, and it shows the date and time that it was done. As yes, we received a call from Brad from Bedford, Texas. He was inquiring about the status of his last claim for his heart medication. And we informed that the check was mailed on January 17, 2009. So the question is, what is the protected information in this case? Well, we've got identifiers all over the place. So there's Brad from Bedford, Texas. We now have a C. A date issued to indicate the payment was mailed, and we know he takes heart medication. So how could I document this as such without having to make it PHI and protected by HIPAA? We take out heart medication. That listed there. So that's one way that I can document the situation. Here's another example. We have a member who held to inquire if a hearing aid battery is covered. So what's the PHI? That was hearing aid batteries. If I wanted to indicate what was going on, I could have said something like advice that her arms were covered, specifying a hearing aid battery. If I had that in there and saw that or disclosed it somehow, I know that she has a hearing problem. Look at another one.
Can I ask a question?
Certainly, go ahead.
When you said that, I'm thinking we've got if we've got the customer's profile up, we're dealing with the customer over the phone, and we know we're dealing with John Doe, and John Doe's file is right in front of me. Can I not make a note like that under the notes section in John Doe's profile because I'm dealing with him specifically, or a covered member under that profile?
Well, the reason that we don't do it is, number one, in the event that the information does get hacked, we don't want to put information in the system so that it can be visible.
Okay.
And number two, we have a couple of situations here within the Word and Brown companies where the external person has access to view this information. In that case, we also don't want to put a medical condition or some type of information like that in a file because, for example, in the world here for Connexus, the clients that hire us and contract with us have access to go into the participant files and see the data in the file.
So is it specifically a HIPAA violation to put those notes in a customer's profile?
If it's readable outside the building.
Yeah, ours would not be readable outside the building. And we, as insurance agents, we're held to the same professional liability that the doctor or the medical professional is when that customer discloses that information to us and we record it in our records.
As of last year, that's correct. So in the event, the thing is we just want to make sure that the information is not getting out to people who didn't have it. So this is why we practice this here. And as I said, in several instances, the employers that hire us and the brokers that hire us can see the exact same information we are seeing. So you have to be wary of that and can't put it in the system. So, for example, if an employer wants up a participant's file, we put down that this person told us they have HIV and are positive for AIDS. The employer hasn't seen that. There's no right to know that. That's why we don't put anything, medical information in the file to that extent. We say, member called out their medical condition and call it quits. So that's a practice that we have here in practice. And if I were to talk to you about it and to make a suggestion, I would suggest you follow the same practice. But it's an internal policy here, and I obviously can't run your internal policy as a company, but interacting with our group and our information, we just want you to be wary of that fact. Just everybody?
Thank you.
Okay. Now, I think that's an internal policy comes to receiving written documentation from a member or an employer or whatever the case. And as here, we have an email that came in from Carla to our respondents team. And it says, I was told that my FSA would cover bioidentical hormone therapy, but you're denying my claim. Paid $475 to the doctor over 4 months ago, and I need this money back. Don't we all? But in case, the question is, have we documented this, or is it a violation? And for our policy, when it comes to a written document that we are sent, we put document in the file exactly as it appears, because we can't document it. So it would not be a violation because it was a written situation that we received from outside that we are placing into the computer file. Some pointers. What information can we give to a spouse regarding the primary member's claim? Well, on the disclosure matrix, you saw that we can give anything to a spouse as long as we can confirm that spouse is on the account, with the exception of specific diagnoses. We get that out. Same thing with regard to, that's fine, that's the same question twice. What can about their covered dependent? Well, it depends. Is it over age or underage dependent? And information can we give a healthcare provider? Well, whatever we're authorized to give them from the primary insured, and our practice is usually to give them eligibility start and end dates, a pay-through date, unless we're authorized to give anything else. Well, that's what we answer on those questions. Information do we need to verify a member's identity? As much as possible is the question. We don't stop at just a name. We want to try and get a name and several other points of verification. So if we can get name, phone number, date of birth, social security number, or something like that, that's better than just getting a name. Can we cover dates to anyone who has a power of attorney on file? And the answer is yes. If it's a medical power of attorney, we can give that information. What information should we leave out when documenting a disclosure? Our policy is to leave out any health-oriented information and you provide a more generic method of documentation. It comes to email, that's a written document, so we cannot modify that or chat, and that has to get placed into the file exactly as it is. So here is the reason why we're here today. Beloved, we are gathered here to discuss what we have to pay should we have any HIPAA violations. So, as a reminder, TECH Act, the Health Information Technology for Economic and Clinical Health Act, boy, somebody's job over there in Washington, D.C. in some corner office to come up with acronyms every day to figure out how to make life miserable on everybody else. That law, under the American Recovery Reinvestment Act of 2009, now says associates are on as covered entities for HIPAA regulations. And these are the violations that could apply. This is the first level of violation, and this is one of those cases where the government will say, ignorance is no excuse. Even if you don't know about HIPAA law, we're going to fine you anyway because you violated the law. In this case, this is the lowest possible level, and it's $100 per day per violation. You didn't know about HIPAA law, we still violated it, so they're going to charge us for it. Assume they want to apply the violation in the first place. And it could be a maximum of $25,000 a year. Level higher, and this is where we might know about HIPAA law, but we just made a stupid mistake. Maybe send a fax to the wrong number, maybe a file to the wrong insurance company, maybe placed a claim in the wrong file. And this is $1,000 per day per violation because we do know about HIPAA law and just messed up. So would be a violation that would apply here in my office. We would $1 violation. We get the $1,000 violation at the lowest point, and this could be up to $100 annual maximum. The next is higher yet. In this case, this is where the violator knows about HIPAA law, but this is not the fund anyway. Will neglect, as they call it, and then we get it later. About $1,000 per day per violation. And this would be where I'm giving information to someone I know is not authorized, or I've stolen PHI for my own gain. And one of the handouts that I gave to Blair to pass out is an article that a staff nurse who violated HIPAA for her own gain. Her husband was in a mobile accident, and her parties filed litigation as a result of that accident. It happens, those other parties also saw the doctor at the medical facility where the wife works as a nurse. And in that case, the nurse had information and took it, and provided that information to her husband because she knew the other party filed litigation. So the husband went to the other party and said, I've seen your medical records. You probably don't want to file this lawsuit. Happened. That oversees the medical group summarily fired the nurse and said, you may have put us all in jeopardy. The rest of the staff at the office, prosecution for violations of HIPAA, under prosecution for violations with witness tampering, pending at this point. Fines, jail time, all of that could apply. So just an illustration of one item where someone has tried to make PHI for their own gain. So do that obviously. And this was the violation that applies at the minimum. Now, a big one. We have one more violation. It's $50,000 per day per violation, up to a maximum of $1.5 million per year. That we've violated willingly, but didn't take any action to correct it. Report it. So that being said, we also have new reporting requirements with regard to the new laws. And the government law says notice must be given 60 days to those individuals impacted by the violation or breach of security. In our business agreements, we are stringent than that. We say 24 hours to 10 days in our company policies and in our business agreements and contracts. We will notify somebody in less than 10 days. The law requires that we send first-class mail, and we may not do that. We might do it first class. It might be maybe registered. It might be certified. It might be by way of FedEx or whatever we decide to do over and above that, but it at least has to go first-class mail. And the next couple of items I want to mention, my colleagues to call this the Self-Flogging Act because we have to report this stuff. If 10 or more individuals are impacted by the breach or violation, we have to post that information either on our company's website or provide it to a local media outlet. If 100 or more individuals are impacted by the breach or violation, we have to report that to a major local media outlet and immediately to the Secretary of Health and Human Services, Washington, D.C. And so the size of the incident or the occurrence, all incidents have to be reported to the Department of Health and Human Services on an annual basis. Some people think Homeland Security. No, it's not Homeland Security. It's Health and Human Services. So we have this annually. regardless of how many people are impacted. So does anybody have any questions about the fines and violations or the reporting process at this point?
No. Nope.
Okay. So some of the examples that could occur, maybe claims are posted to the wrong account, maybe disclosing protected health information to an unauthorized party, maybe send an email with PHI unencrypted or to the wrong people, in fact, emails to the wrong recipient, cases because we do allow system access to external sources, maybe we provided system access to a wrong person, that could be a violation, or included protected information in documents that we distribute externally. Any of those things occur, that's not a good thing. As you hear, this is the text of an email, and it says this is coming back. This is from John, January 28, to customer service, talks about claim status updates. FYI, you're sending these to the wrong address. I don't know what your company is, and I have certainly not filed any claims recently, or ever for that matter, John. And your email address says jjones@gmail.com. Well, it's supposed to go to Jane Jones, not John. And it has been changed to protect the innocent and guilty. So in this case, it was a situation where somebody didn't quite verify the address that was being used for the email. And it was sent to John Jones rather than Jane. So things we have to be wary of when we're sending emails out. When we're reporting violations, this is our internal policy here. We contact our immediate manager or supervisor. Let them know what happened. At that, the supervisor or manager can talk to our compliance group, and an incident report will be filed as needed. Then at that point, the client or member will be notified as well. Appropriate steps will be taken to correct the action and to apply any sanctions against the violator, as employee here of our company. I mentioned we do have certain sanctions that we put into place should somebody have a problem with the law or provides information they shouldn't provide. And it's kind of a 3 strikes thing, and each level is higher and more severe. So when it comes down to it, this we do, I would suggest that you adopt a similar situation in your offices. You may have already. So I told yesterday, you do have someone who is in charge of keeping MAP compliance, and you might go to your manager, and then they will talk to the compliance person, just like we do here. So whatever you folks do in your office to report is, I would suggest you continue to do that. Now, let me know something that actually happened. And if you look at the screen, you will see a picture at the bottom with a bunch of boxes that has information in it. What happens in this case is the chief compliance officer for our company was coming into the building one week and performed a HIPAA audit after hours, about 6:30, 7 o'clock in the evening. Walked on and found what you see here. And some folks had information under their desk in boxes, and that wasn't for the intent of HIPAA necessarily, but it was for the purposes of having a box under their desk to put recycling in and shredding in, so that they have to get up every 2 seconds to go to the box and dump the material. So the person shouldn't keep that under your desk at any one point in time. If you have something to shred, just go ahead and take it over to the desk where the shredding material is and put it there. The example I gave yesterday is if you do that box under your desk and you are called away for some reason, maybe you got a phone call from your child's school and you pull them out because they're sick. About that box under your desk, it's now accessible by anybody who comes by the desk. So good. In this case, there were lots of unlocked drawers like live checks and claims, social security numbers, mail logs that had social security numbers, and even the employee's own information here at the office. The employee's information was in their desk unlocked. Their credit card receipts and credit card materials, applications, social security numbers. They all found that night. So the idea is we have to keep everything secure. Keep it in a desk drawer, locked file cabinet, a locked location. Let me give you an idea of our security process in that case. As I mentioned earlier, our doors that access our offices have electromagnetic security access with our badge. That's step number 1. When we go in, our information that we have on paper are in cabinets which are within locked rooms. I need keys to get to it. Even if I get to the room, I still can't get into the cabinet unless I pry it open with a big crowbar or sledgehammer or C4 or whatever I want to use to get the cabinet open. So we take steps to make sure that the information is secure if it's on paper. Of course, we do everything we can to make sure everything is secure within the system with firewalls, our virus protection, our spyware protection, everything that we can. Anybody any questions?
No.
Okay. Now, we didn't bother with a pretest, so I'm going to pass by that information at this point. But we do give a pretest in class that we go over in class here in the office. What I mention is that week when Katie Bryant, our VP from Health Compare, comes up and presents her information material, one of the things that she's going to do is provide you with a written exam based on what we've talked about today for HIPAA. Now, that 32 questions on it. And you can use all the material that you have at hand to from that test, complete the information. It's own book, if you will. And we like a passing grade of 90%, and Katie has the answer with her. She will go ahead and provide you with that information once the test is complete. So it can miss, I think, 3 or 4 questions on that one. And if you have any questions about that information while it's being done, you can ask Katie a question if you'd like, but she can't give you an answer, obviously. I'll be available on my cell phone from Katie. She can give me a call if there's any questions about the test when it's being taken. But I do want to have you at least go through that. You know, everybody's on the same page with regard to the material presented today. I want to ask at this point if anybody has any questions about the HIPAA discussion so far and how it might apply for you.
No.
Okay. So thanks for listening on that one. And want to bring to our attention here's my last slide. It just shows that obviously we're starting a relationship right now between Health Compare and BellaPoint under the word Brown Umbrella. And we want to thank you for your involvement and your interaction with us because you are certainly going to help us to become better and to grow as part of this process. And as part of this process, that's why we're discussing the information we're talking about today. But thank you very much. Now, that being said, let me go ahead and remove HIPAA. And if everyone wants to do so, we can take a quick break, or we can just push through this, which will take about 45 minutes. What's the consensus?
Let's push through.
Let's push through? Okay. My kind of crowd. All right. So, you have a handout, a material that says COBRA Basics on it. It's a workbook. It would have the picture of the medical caduceus symbol on the top to identify that. And we talk about COBRA. The reason I want to discuss some of these items pertain to the fact that these are the people that you'll be talking to. Not necessarily to help you understand COBRA, but to understand what the people are going through with trying to decide whether or not to elect COBRA, and if they do so, how COBRA works and that kind of thing. So rather than talking about big poisonous snakes, obviously, we're talking about a different kind of COBRA. And I want to ask if anybody in the room has had the opportunity to exercise their COBRA rights, and if so, did you?
Yes. And no.
Oh, a lot of yeses.
No. Yeah.
Yes and no. Okay. That being said, what kind of experiences did you have in dealing with COBRA, as it were?
I take it because it was too expensive.
You just hit the nail on the head in most cases when people are talking about COBRA. Number one reason why somebody doesn't take COBRA coverage is because it's too expensive. There are other reasons that people don't take COBRA. Some people don't want to do it because maybe it's a bit of a headache for them. I know that employers I talk to consider it a headache as far as administration. Maybe they found a better policy somehow. Who knows? But the number one reason why somebody doesn't take COBRA is because it's too expensive. Is in our historical reference, we find that only 10% of the eligible people actually elect COBRA because they have illnesses, they need chronic patient all the time, they're seeing doctors all the time. Those are the people who usually take the COBRA. Now, you may know, the American Recovery and Investment Act of 2009, part of that stimulus package, in that anybody who was involuntarily terminated from their job, when they did COBRA, would receive a premium reduction in the amount of 65%. That is, would only pay 35% of the total premium. that was looking pretty attractive to most folks. So we saw a market increase for elections. Looking at some different websites, some of our partners and clients and some other places, I found that in some cases, and based on some industries, COBRA increased by 76%. Big city. Now, June 1 of this year, no one is eligible to take the subsidy because that's when it expired with regard to eligibility. We have some folks who are on subsidy at this point paying 35% of their premium, and their 15 months expire. They go to the regular COBRA premium payment. But what is COBRA? Well, it's the Consolidated Omnibus Budget Reconciliation Act from 1985, COBRA. And the COBRA law, as people think, well, that's not the case. People think there's a COBRA company called COBRA. Nope. What it is a law that's focused on how employers have to allow employees to continue their coverage once they've left the job. So it focuses necessarily on insurance providers, but employers. It focuses on those employers who have 20 or more employees over % of the previous calendar year. That federal COBRA applies to. And when it comes down to that, that's why a lot of folks hire groups line because, as you see at the bottom bullet point, administration is challenging. There are things to think about when administering COBRA, especially when we want to maintain compliance. Since 1986, COBRA has been an issue and been in place. Since 1986, that's when our company here in the group called Connexus was born. And then we've been administering COBRA for people. Flexible spending and HIPAA. So a little bit about the COBRA law. Let me show you who COBRA does not apply to so that we can understand who may not be calling us on the phone. Small employers do not have to worry about federal COBRA. They are employer groups that have under 20 people with health care plans. Federal doesn't apply to them. However, in some situations, a state continuation law may apply. And the one most near and dear to my heart is Cal COBRA here in the state of California where I'm sitting. And that applies to any employer that has 2 to 19 employees that offer group health plans. So they follow Cal COBRA instead of federal COBRA. Federal government does follow federal COBRA law. They're under the Federal Employee Health Benefits Amendment Act. That has a continuation clause on its own. State and local governments do not have to follow federal COBRA because they are following the Public Service Act. Certain church plans, if they meet the government's requirements of nonprofit and free status based on the definitions in the code, don't have to follow COBRA. However, we do have clients who are church organizations that, because they don't meet those definitions and because they do for health plans, that they offer COBRA. So in most cases, if you do not fall within these groups, COBRA applies to you, and thus those are the people that we talk to on the phone all the time. So let's talk about what COBRA is. This definition comes from a group called the Employee Benefits Institute of America, or the EBIA. And we get this definition because it allows us to bring up several different terms to introduce concepts. And here we have the definition of what COBRA is as far as the EBIA is concerned. A qualified beneficiary has to lose group health plan coverage so qualifying event. We'll talk all those things underlined as we proceed. The most important facts about COBRA is that the member, or the potential COBRA member, must elect COBRA to it. They do not receive COBRA benefits. Employers are confused by that fact. Because they put this person on a severance package and continue coverage for them, that they're on COBRA. That is no. You're not on COBRA until you have elected and started paying for COBRA. And as you elect and maintain your premium, you may have the COBRA. It is for a limited time, however, without that. And it is on a self-pay basis. As we heard earlier, somebody said, I didn't take COBRA because it was too expensive. Well, that's the reason why. It's because we are now paying 102% of the applicable premium, COBRA subsidy notwithstanding, with COBRA. That usually provides some type of stick shock when they see their COBRA election form. I actually installed a plan last week for one of our employers where the family coverage premium month was $1,800. So that being said, you can see that that is very expensive to maintain COBRA coverage. When I had the opportunity to take COBRA over 6 years ago, I started for this company. Monthly premium for my plan would have been $800. So what my response was in taking that plan, no thank you, and decided that I would probably get a job fairly quickly, and I didn't think I'd need to worry about having the coverage for a few months, so I bothered not to take it. And luckily enough, knock on whatever knocking on, that I did not need insurance coverage. So most people have that to decide. They'll take a look at the expense of COBRA and figure out whether or not they need to pay the money, have the plan, versus if they think they're going to need it during the time frame that they're off. In a lot of cases, maybe if they have kids, they might decide to take that. In some cases, if they don't, like me, I'm one of those people who never goes to the doctor unless he's absolutely sick and ill and needs medication. And in most cases, when I go to the doctor, I've already given the doctor my symptoms. I've already given him a proper diagnosis and told him what medicine I need. And they say, what are you doing here? I says, well, I'll write the prescription. You have to do that. So I don't go to the doctor most often. Usually it's just for my FAA physicals for my pilot's license once a year. That's when I go to the doctor. And so I didn't take my COBRA, but to make that decision, do I want to pay that $800 a month, or do I want to buy a house, or they're paying for it? Which I now, up in the corner, we have Health Compare to provide people with an alternative to COBRA coverage, expensive alternative to COBRA coverage on the family plan market. So talk about some of these things here. When it comes down to COBRA, what is a qualified beneficiary? There are 3 categories as defined by the government in the COBRA law. And when it comes to a qualified beneficiary, the first one is us, the covered employees who are on the health plan. How, in order to maintain COBRA rights as a qualified beneficiary, you must be a covered employee who is in the health plan, the eligible health plan, the day before the qualifying event. That's in the COBRA law. For example, say I no longer want my coverage, discontinue my coverage while I'm working here, and then a month later I leave the company, there is no obligation to offer me COBRA at all. We couldn't have a qualifying event causing a loss in coverage. I coverage off myself. The company didn't take it away from me. We left the company. So I don't get COBRA. So a covered employee who's on the eligible health plan the day before the qualifying event. This category of individuals are the spouses and dependent children of covered employees who are on the health plan the day before the qualifying event. So it'd be my spouse or dependent children if I have them. And as we talked about yesterday, there were questions asked among the group in the room where somebody said, I know this guy who was asking whether or not he could take coverage for his spouse and leave off on the dependent children off of COBRA because the spouse had some illness already. So that question is, of course, one who definitions that you see on the screen has independent COBRA rights from each other. Just because I'm not taking COBRA doesn't mean the wife can't. As long as everybody meets the definition of qualified beneficiary, each one of these people has independent COBRA rights. The category is an addition based on HIPAA law as amended to include children born to or those adopted by qualified beneficiaries during a period of COBRA continuation coverage. If I'm married and Mouse and I have a baby, and we need to the COBRA coverage, do that. HIPAA law says we have 30 days to do that. But also says now is that these children who are born to or adopted by of us on COBRA, they likely receive qualified beneficiary status and the independent rights. Now, I have a 5-year-old child, and that 5-year-old child later, after I elect COBRA as a result of open enrollment, let's say, that child does not have COBRA rights and is not a qualified beneficiary on the plan the day before the qualifying event occurred. How, if it's a child who is born to me during COBRA, then that qualifies as a qualified beneficiary. Anybody have any questions on these three items?
No.
Let's look at the definition of health care. We need to know this because we need to know then what health plans fall under this definition. Now, the government provided two definitions for our situation here at my group because we handle COBRA administration. We also handle flexible spending administration. When it comes to flexible spending administration, this definition applies to any medical expenses that can be claimed with FSA dollars. When it comes to COBRA, the definition applies to any health care plans that fall under the definition. COBRA eligible. The problem was originally that the government used two different terms. In flexible spending law, they say medical care. COBRA law, they say health care. We need a clarification from the IRS to say, okay, which? And as far as they're concerned, it means the same thing. So medical care or health care as defined by the government is any plan or expense that for the diagnosis, cure, mitigation, treatment, or prevention of disease and purpose of affecting any structure or function of the body. The health care meets that definition, then it's an eligible plan. If the flexible spending dollars meet that definition, then they're eligible expenses. That includes transportation for medical care, ambulance, air ambulance, etc. And any billing that comes in those things also apply as eligible. So, what kind of plans are we talking about when it comes to being able to take the plan for COBRA purposes? We're talking about your regular old medical plans, your HMOs, your PPOs, your medical indemnities. We're also including personal X plans. We're talking about alcohol, drug, and treatment plans. We're talking about dental and vision plans. In some cases, employers and brokers forget that applies to dental and vision. Those conversations where folks will say, what do you mean? I have to offer dental and vision as part of COBRA? The answer is yes. Under COBRA, dental and vision are eligible plans. Flex spending is an eligible plan. Health arrangement is an eligible plan. So those things under COBRA. What doesn't apply? Well, for COBRA purposes, I could not elect to continue life insurance. If I'm claiming on my life insurance, I'm probably beyond health care already. If I'm using accidental death and dismemberment benefits, I probably don't need health care anymore. I can't take my gym program with me. Any other life insurance plans where they're used for the benefit of getting revenue, like universal life or things like that, whole life. So those types of things do not fall under COBRA because they're not for the diagnosis, cure, etc. All the plans that meet this definition will fall under that category. Let's talk about documentation for a little bit and documents that we have to worry about for these people that we're talking to. As you see here, we have a gentleman who's got a little bit of a workload today. And like I said yesterday, it was days like this that changed me from being a guy who's 6'4" to 5'11". But in the sense of what we're doing here, COBRA will kill trees because we have a lot of documents that we have to send out and we have to that they're compliant and that we maintain compliance. So the documents that we worry about are the COBRA General Rights Notice, number one. This is a document that we send to all member employer who have elected to participate in the medical plans. And in that sense, we have 90 days to send that document out from the time the person elects the medical plan, or I should say the effective date of the medical plan, to make sure to send it out within 90 days to maintain compliance. And the document just shows what your COBRA rights are should you need them later on. It explains how COBRA works, what COBRA is, what you can do, what you can't do, what you do, how to collect payments are like, as far as how you have to make your payments. So that's the general notice that you should get at the outset of your medical plan with any employer. The most familiar to everybody is the COBRA election notice. That's the document you send when somebody has a COBRA qualifying event causing a loss in coverage. You leave the employer. What qualifying event occurs, we'll talk about those in a minute. In addition to, once again, inform me of my COBRA rights, the election notice will also tell me what the qualifying event is, what the qualifying event is, when I will lose my coverage as an active employee, how it will me to continue the coverage, how to elect, who can elect qualified beneficiaries, and so on. And timeline specific for that document, we'll show you that in a second. We also have to worry about a notice of unavailability. That will be a case where I send a document to inform somebody that they can't have COBRA coverage for whatever reason. Examples would be, I move from California to a state where my employer does not maintain an insurance plan. If I decided to hand my notice, and right after that I go from here to the middle of Mississippi, my company doesn't keep any plans in Mississippi, so I don't have any COBRA to elect. Maintain COBRA coverage, the employer has to maintain a plan. Without the plan, there is no COBRA continuing coverage. So a document out that says, Mr. Bob, you don't get to take COBRA because of this circumstance. I would send that in lieu of the COBRA election notice and in the same time frame. This document we see is notice of early termination. Now, at offices, we don't actually differentiate between early termination or termination for any other reason. If somebody terminates, we're going to send them a document saying why and what alternatives are afterward. The government does specify that you do have to notify somebody if they're terminated prior to the end of COBRA eligibility. So the document just says, you've been terminated, here's the reason why, here's the date, and here's some things that you can think about if you want COBRA coverage elsewhere. So those are the big documents that we worry about here, and thus this is the documentation that goes out to the members that we talk to all the time. In addition to that, we send a notification that says if you are interested in alternatives to your COBRA coverage, you can contact the sister company, Health Compare, or you can go to the website at healthcompare.com, which I invite all of you to do and take a look at the website so that you can have an idea of what's going on. And Katie Bryant, I'm sure, will be talking to you about that when she comes up. But feel free to use that. Feel free to pass that on to other people that you know where they have questions about individual family and plan coverage. Feel free to let them know that they can go to healthcompare.com and take a look at it. So anybody have any questions about the documentation?
You went through everything so fast it was hard to note down on our little page all the answers to the blank lines, that's all.
Okay, I apologize. Okay, what were the other questions that remain that you need answered?
Almost from the top. I mean, we've tried to write and you're just moving real fast, so it's hard to...
I don't think he's got there.
Yeah. I have just done the number one, which is a COBRA administrator has 90 days from the qualifying event to the COBRA coverage.
That's correct.
COBRA general rights notice.
What's the next one? Go ahead and read that for me if you would, because I can't put it up on the screen.
COBRA qualifying events, you had mentioned leaves employer, but you didn't mention the second one. You said there's another one, but you'll get into that later.
Yeah, the next question that you have there goes to the next slide. It's not covered on this one, so
all right.
Let me go ahead and pull it up. The qualifying events that we're talking about, we have, actually there are 7 specific qualifying events that the government has defined, and we divide those into 2 categories. We have events that are valid for 18 months of COBRA law, and qualifying events that are valid for 36 months of COBRA law. You can also further define those into different categories of having qualifying events for the covered employee and qualifying events for the dependents. On the left-hand side of the screen, we show 18-month qualifying events, and those are termination of employment, this voluntary termination, I quit, whether that's involuntary termination, I'm fired. The qualifying event that pertains to employees is reduction in hours. In cases, if a reduction of hours occurs, that will probably take me below the amount of hours I need to work to be considered full-time and thus to be able to participate in the insurance plan offered by my company. So termination of employment or hours causes a loss in coverage in any of those situations. The employer is obligated to offer me COBRA. And if I do take COBRA and maintain my premiums, it's 18 months that I get to keep. This is a federal COBRA, remember. The qualifying events that pertain to the covered employees, those on the left-hand side of the line. On the right-hand side of the line, we have the 36-month qualifying events that pertain to dependents. So we have death of the covered employee, we divorce or legal separation, loss of dependent child status, meaning that my child is now over age to which I can no longer keep him or her on my insurance plan. The covered employee becomes entitled to Medicare, meaning that for COBRA purposes they are enrolled in Medicare, and then coverage is lost for the dependents. And bankruptcy. How bankruptcy applies to anybody only on retiree plans and their families. So any of those occur, that's a month qualifying event for the dependents. And that is the law. Now, we apply again in California here where I'm sitting. For example, Cal COBRA, let me have cover for 36 months anyway, total. But for federal COBRA, we have 18 months and 36 months. Do we have questions about these qualifying events?
No.
Okay, did we cover some of the questions that were sitting there on the page?
Yes.
Yes.
Okay. Let's go to the timeline that applies when it comes to COBRA and electing notices. Here we have events that occur specific to the COBRA action timeline. The thing that would have to happen is that I, as the employee, would have to terminate my employment, and then as a result have lost my coverage. So when the employer has to notify the plan administrator if it's hired one. That would be, in my case, Connexus here in our office. The employer can also do their own COBRA administration if they like, or maybe their insurance carrier is doing the COBRA administration, whatever happens to be the case. If the employer has an external party or a third-party administrator taking care of its COBRA, the employer has 30 days to notify us. Once that notification is issued, and in our case, that's done on the website that we have, the next has to happen is the plan administrator has to send out the COBRA election notice document. We have 15 days to do that. If the employer happens to be doing their own COBRA administration, what we do is we tie those together, and the government says that the employer has 44 days to send the document, putting two particular timelines together. Sent the election notice, at that point, the member has to decide whether or not they want to take COBRA coverage. As we all discussed earlier, in most cases, we don't. Why? Cost. But assuming the person does take COBRA, they have 60 days to make that decision. 60 days will begin at either the date after loss of coverage or of the notice itself, when it's mailed. If the person did elect COBRA, they have to now begin their payments and bring their account up to date. They have 45 days to do that from the time frame of their elect being signed and mailed. So that 45 days, they have to make their initial premium and catch up on any back months that they got, because law says there cannot be a break coverage when electing COBRA. So COBRA coverage goes back to the date after I've lost my insurance as an employee. So this entire timeline that's expired, we're talking about 149 days can go by legally. A premium I have to pay, put back into place. So let's say the employer waits their 30 days. And let's say the administrator waits its 14, and the member waits their 60 days to elect and then waits their 45 days to pay. If we were talking about that plan I mentioned earlier, where family coverage is $1,800 a month, I have to go take a loan out to bring this up to date. So that we're offering an alternative to COBRA coverage under Health Compare, and this is why most people don't elect COBRA. It's because it's involved, of course, but the legal timeline that can occur from somebody terminates to the point at which they have to make their payments and bring them up to date. Any questions on the timeline here?
No.
Okay. What about paying for COBRA coverage? When it comes to payment and premiums, the law says that we charge up to 1 and 2% of the applicable premium under federal COBRA. And that's just regular COBRA coverage. There's a situation where somebody can extend their COBRA beyond 18 months if they're awarded a disability from the Social Security Administration. And they are awarded disability and they want their extension of COBRA. During extension, we can charge up to 150% of the premium. Now, the question was asked yesterday, well, what does the employer care whether somebody elects COBRA or not? Because they're not paying for it. Well, the employer is not paying the premium, but the employer is impacted another way. That was remove the PowerPoint slide for a second, and I'm going to bring up my you folks there?
Here.
I thought I lost you for a second. Sorry. Let me put my whiteboard for a second because I'd like to illustrate a couple of things. Hey, look at that. My picture stopped. Let's do here. 102% is what I can charge COBRA. Down into two factors. 100% and 10%. Who's the 100% of the premium that we send out?
Insurance company.
Insurance company, that's right. That's their fee for what they call cost of the plan. Who gets the 2%? The employer gets the 2% if they're doing the COBRA administration. If they've hired an administrator, like my company, the 2%. One of our revenue generators is the 2%. So that's how that breaks out. Let me go ahead and put another factor up there. Let's talk about COBRA disability extension. That's 150%. That breaks out three ways. There's 100%, 2%, 48 left over. So it's the 100%, that's the insurance company. Who gets the 2%? The administrator, whether that's the employer themselves or whoever they've hired to do the job. That's 48% left over. Where does 48% go?
We don't know.
Some people will say the government. Nope, that's not quite right. Some people say the insurance company. Nope. Some people say the employer. That's correct. The employer gets that 48%. Here is how the employer is impacted by somebody electing COBRA. Any group on 50, this does apply to, but larger groups, they go out to the insurance companies, or their brokers do, and ask for a quote. Shop out the plan, or they go to their current insurance company and ask for a quote for the new year for renewal. The insurance companies will ask for a census of employees, including gender and age, so that we can see risk factors. They'll also ask if they have any high-dollar claims, like cancer claims or things like that, and at least 2 years of a claims experience for the underwriters. So I've got somebody who is on COBRA. Remember, who are those people who are taking COBRA? People who are sick, people who are chronically sick and need a lot of medication, people who want to continue their coverage because of their current condition and don't want to change doctors or hospitals, etc. Sometimes people who are on disability, more high-dollar claims. How the employers are impacted is that when they go to try and quote the plan, whether it's for a new plan or whether it's for the current plan, the premiums are going to be higher. That's how the employer is impacted. So that's why they worry about whether or not somebody takes COBRA. Does that make sense to everyone?
Yep.
Okay. So when we that, I'm going to go ahead and back to my presentation here, and we'll share that again. That we think about it from the employer's perspective. So premiums is 102% normal situations, 150% if someone's on disability and they want to extend their COBRA further. When it comes to those premiums, they have to remain fixed for 12 months. We change them unless one of the three things on the screen occurs. If they start their disability extension, we can change from 102 to 150%. If they change coverage during the year, we can also change the premium. So, for example, if someone has a baby and wants to add the baby, we change it to family coverage. If somebody gets married and they want to add the spouse, we can change it to employee plus spouse coverage and change the premium. And not charging the allowable amount by the government, whether it's the 2% for 50% under disability, we can then add that throughout the year if we wish, to 2% or 50%. The law is we do not have to charge that. Hey, can't think of anybody who hasn't, and there's only a handful of folks that I've ever talked to in our employer base where they don't charge the 50% for disability extension, but we will charge the 102 because 2% comes to us here at our offices. When it's paying premiums for COBRA, that goes by the U.S. postmark date as to whether or not the premium is timely. And it means it has to go through the post office and have cancellation on it for us to consider it paid and to consider it. And for COBRA purposes, payments are always due on the first of each month, except for the 45-day rule I told you about, where they can, once they sign their election, they have 45 days to make their initial payment and bring their accounts up to date. But under no circumstances, after that, payments are due on the first of each month, and there's a 30-day grace period, and why we bill in arrears. About modifying COBRA coverage. Can COBRA, once we have the opportunity to elect COBRA, the answer is no, because to elect what was at the time of the qualifying event. They had medical, dental, and vision. To either take medical, dental, and vision, plan was on, HMO or PPO, indemnity or whatever, but I can only take what I had in place. However, if I want, I can elect just medical and forget dental and vision, or just dental, or vision, unless the plan is packaged as what we call a bundled plan from the carrier, and that's what was purchased by the employer. In that case, I have to take everything all together. But when it comes to electing, I can take just the medical, or just the vision, or any combination thereof. Now, COBRA, there are causes to have me change the coverage, and these are some examples of that. If the employer changes from one health plan to another while I'm on COBRA, I'd be given the opportunity to change to the new health plan. So they go from Blue Cross to Kaiser at the employer. Me, a COBRA participant, I have to be able to go from Blue Cross to Kaiser. I'm not required to. If I want to, I can drop the coverage and just go elsewhere. But the employer is obliged to give me that opportunity. When it comes to the participant moving from one geographic region to another, talked about earlier, if I move from California and go to the middle of Nebraska, my understanding is, we don't have any employees in Nebraska, so we don't have a plan that covers us there, and thus I would be out of luck and would have to discontinue my COBRA coverage. Enrollment is another reason I could change my coverage. Maybe I had a chance to elect PPO medical plan when I was eligible to take COBRA. Enrollment has come up, maybe change to the HMO plan. Can do that during open enrollment. All of these apply because it's linked to everybody at the employer. On active employee coverage at the job, if there are specific rights and capabilities, and just I get that same thing under COBRA law. Reads is that whatever I do to a similarly situated active employee, I do for somebody who was on COBRA continuation. So in open enrollment, they're allowing me to add, remove dependents or add or change plans. Anybody has to be able to do the same exact thing. And that we talk about are the HIPAA special enrollment rules that I mentioned earlier. It's where, let's say I have a baby with my spouse, and with baby to the coverage. I have 30 days to add the new baby to my COBRA coverage. If I'm married, I have 30 days to add my spouse to the COBRA coverage. However, one of these people becomes a COBRA qualified beneficiary and has COBRA rights. Is the new baby or the new spouse?
Baby.
The new baby is correct. Remember, one of the qualified beneficiary categories would be children born to or adopted by somebody during a period of COBRA coverage. So if I have a baby and add the baby to plan within my 30 days, the baby automatically becomes a qualified beneficiary and has independent COBRA rights. If I get married and add a spouse to the plan within 30 days, my spouse, although I can add to the plan, yes, my spouse does not have independent COBRA rights as a qualified beneficiary. So if we divorce later, he doesn't get to continue the plan. quick note on coverage other than COBRA. In Medicare, it could be anything else. It came out in 2004 from the IRS that further clarified how we can handle multiple coverages pertaining to COBRA. It was IRS ruling 2004-22, result of a court case that occurred in the Supreme Court in 1998. The Diesel versus Moore Medical Corporation. In that case, the medical corporation decided that their employee or former employee did not have to be offered COBRA because he was covered under his wife's policy. And the Supreme Court saw differently, and thus the IRS issued its ruling on that to indicate that under COBRA law, the situation is that if I have any coverage in place before COBRA starts, or the qualifying event, whether it's Medicare or anything else, I offered COBRA and I can take COBRA. If while on COBRA, obtain coverage, COBRA. So this 2004-22 did for us. It kind of defined further what the things we need to worry about in dealing with multiple coverages where COBRA is concerned. A coverage in place before COBRA qualifying events, the employer has to offer me COBRA and I can elect COBRA. If coverage is obtained while on COBRA, terminate. Okay, there are a couple of ways that we can extend COBRA. One of them was a disability extension that I talked about. COBRA is valid for 18 months. COBRA is valid for 18 months. And if during that time frame I am determined disabled by the Social Security Administration, I actually elect to extend COBRA beyond 18 months for additional 11 months and for a total of 29 months. Kind of bridging the gap between where COBRA ends and permanent disability begins, which is a 24-month period. Takes into account any disability plans the employer may have, usually ending at about 5 months. So I have 29 total, 11 after the 18. In order for me to be eligible for this, I have first received an award from Social Security Administration indicating that I am disabled. Award, it'll say they consider me disabled as of a particular date. That date has to be within the first 60 days of COBRA or prior to COBRA beginning. In addition, in order to get this extension, I have to request it either toward the end of COBRA or within 60 days of the receipt of my award letter. Once I make that request, I extend my COBRA for an additional 11 months. However, as I mentioned earlier, I can charge 150% for 11 months between for my premium. This is one way that COBRA could be extended past 18 months. Another one that we could extend COBRA past 18 months would be qualifying events that happen during that time frame. The dependent qualifying events are valid for 36 months. Those are 5. Death of a covered employee, divorce, legal separation, loss of dependent child status, enrollment in Medicare where the dependents lose coverage, and bankruptcy for retirees and families. Now, while I'm an active employee, let's say I am out flying a plane one afternoon, say, and I didn't see that hill in front of me, I smack into the hill, I pass away. In case, my spouse and children will have a qualifying event which equal 36 months off the bat. However, if we're on COBRA and my spouse and I get a divorce, elect to take COBRA for an additional 18 months, a total of 36, and an additional 36 months. So the qualified beneficiaries that are on the plan originally, from the start of COBRA, runs from when the event occurred, when the original COBRA event occurred, not from the second event. So I'm going to clarify that graphically here. Say I have a COBRA qualifying event that occurs May 15 of 2006, causing a loss in coverage. I terminated the job. In some cases, it can be same day. Most cases, it's end of the month. But for our example, it's May 15, 2006. COBRA will usually end 18 months later, November 14, 2007. If during that time frame another qualifying event occurs, like a divorce, divorcing spouse can elect to continue coverage for an additional 18 months, not a total of 36. A total of 36, but not an additional 36. And in this case, her coverage begins still from May 15. So the first 18 months goes up, and the second 18 months goes up for a total of 36, and she will end COBRA as of May 14, 2009. So to sum up, in COBRA, it goes 18 months from May 15, 6 to November 14, 7. If during that 18-month period there's a divorce, for example, the spouse can additional 18 months from 15 expire 14 of 2009, 6 months later. Questions?
I think I just missed, a couple of us missed the number 2. The COBRA disability extension is designed to provide coverage between the end of COBRA and the start of permanent
Blank.
Permanent Medicare disability.
Medicare disability. Okay.
Right. So it comes down to it, there's a 24-month waiting period for that. If Social Security Administration awards that to me, there's the 24-month waiting period, and my company may also have had some type of disability plan, long-term or short-term, that could take potentially out to 5 additional months. So that's why it was decided that there would be an 11-month extension possibility totaling 29. That would take the person from the 18-month end of COBRA through the beginning of the permanent Medicare disability.
Okay.
All right.
Just to clarify, question 3, COBRA disability extension allows the member to extend coverage a total of 36 months.
No,
False, correct?
Yes, that would be correct. It is false. Yes.
29 months.
And the
29.
disability has to be, you have to be deemed permanently disabled within the first 60 days of COBRA.
Correct. Anything else that we missed on the document?
I think we're good now.
Okay. Let's talk about a couple other compliance items when it comes to COBRA. Notices are sent first-class mail. That's what the government prefers. We don't do it any other way because that is chased to the possibility of litigation, as you see here in the center of the screen. I'm not going to bother going through this story to save everybody some time, but because law prefers first-class mail, that's how we send our COBRA election documents. In a sense, when sent by first-class mail, the government assumes as a result of current COBRA law, we don't have to prove a document has been received. We only have to prove a document's been sent to the last known address of that employee. And as such, we do have proof of documents with the U.S. Postal Service, which also reflects the same information in our internal computer systems. We can prove any time when a document's been mailed. Let's the COBRA police. We talked earlier about the police. That's the Department of Health and Human Services. Who enforces COBRA? That's 2 agencies. The IRS, the Internal Service, and the Department of Labor. The involved is because COBRA regulations fall under Treasury codes. The IRS oversees those regulations. The Department of Labor is involved to help ensure compliance, document compliance. So both agencies are involved when dealing with enforcement of COBRA law. The employers are responsible for informing their employees and their former employees when it comes to COBRA, and are responsible for maintaining compliance. They're also responsible for maintaining compliant communications. And so one of the reasons, or this is one of the reasons that the employers will outsource their COBRA administration to groups like mine, because it shifts the work to us, obviously, takes it off the employer's plate so they can concentrate on the business of doing business. It also shifts the need for expertise to groups like mine. However, I will say and throw in the caveat that the employer is not off the hook when it comes to having to follow COBRA law. They are still responsible for doing that. It's just that we help them maintain that compliance. Now, should the government decide to throw a flag on the play when it comes to COBRA violations, That's my little referee here with his penalty bag. These are as follows. For COBRA penalties, it's $100 per day for failing to provide COBRA coverage to any individual, and $200 per day if more than one qualified beneficiary is involved. In addition to COBRA penalties, there could be ERISA penalties from the Employee Retirement Income Security Act of 1974. That's granddaddy of all group welfare insurance policies. And so if ERISA penalties are applied, up to $110 per day per violation per qualified beneficiary. Now, when it's to the HIPAA violations we talked about before and the COBRA violations, it's first of all up to the government to decide whether or not a violation is warranted, and to them to decide how much of a violation to assess based on what happened in that violation. So maybe they don't charge $100 a day. Maybe it's $1 a day. Maybe it's a flat fee on something that includes medical care for the member as part of the court settlement, whatever it is. But these maximum amounts that they can do, and for employers, they can be penalized up to $500,000 maximum, and the insurance companies can be penalized up to $2 million maximum when it comes to COBRA law. These are the violations that we worry about and that we try and keep on eye when it comes to in compliance. And the last item I'm going to talk about today is termination from COBRA coverage. When does COBRA end? When my COBRA eligibility expires, if my 18 months are up, or whether it's just me by myself or whether I've elected COBRA for my spouse and dependent family members. That, by itself, is not a COBRA qualifying event. Employers ask that question. A group of people here who are on COBRA coverage for their 18 months, it's expires September 30th, doesn't that mean that the spouse and the dependent children get a qualifying event because they've lost their coverage? The answer is absolutely not. It just means they've ended their COBRA. That's it. They get 18 months. Now, I had a qualifying event during the COBRA, like the 5 we talked about, where it was death of the employee or divorce. Then they can extend the COBRA beyond the first 18 for 36. So, eligibility is a qualifying event, and that's COBRA terminate. Number one reason why people terminate from COBRA coverage is failure to pay their premiums, whether they haven't paid on time, they paid enough, or they haven't paid at all. There's a law that applies to that too. If we call it the 1050 rule. If we have a premium payment from a member that's with 10% or $50, whichever is less, we have to consent payment paid for the month, and we can do the overage on the next invoice. To pay premiums is why somebody does not renew their COBRA. Employer no longer has a group health plan. And a story about personally that I was involved in, where there's a gentleman who called us up one day and said, I've elected my COBRA, I've been paying my premiums, it's up to date, why terminate my coverage? That's right. He's been paying. The reason that his coverage was terminated was because his employer did not pay their insurance company's bill. So this company canceled the policy. This poor employer didn't pay our bill at Connexus for services rendered here at the Word & Brown Companies. Terminated him as a client. Because his employer no longer had an insurance plan, he no longer had COBRA. Understand, of course, he thought COBRA was an insurance in and of itself, that he was obligated to have it because he didn't pay it. But he didn't seem to get the action. That's because he was continuing the plan he had at his former employer. It's not a separate plan. So if the employer gets health plans, that means their coverage. Any other coverage during a period of COBRA, my COBRA will terminate. Back to Giesel versus Moore and the IRS ruling 2004-27. Enroll in Medicare, same thing. If at some point the Social Security Administration comes along and says, well, we no longer consider you disabled if I'm on my 11-month disability extension under COBRA, that would terminate. that coverage is contingent upon having been disabled to begin with. And thus, fraudulent purposes, for medical claiming, misuse of the plan. It happens, I could be terminated because I am being fraudulent. So, if think this occur, my friend up there in Sacramento tells me that I could be terminated. So, here we have the governor of California, or soon-to-be former governor of California, telling us to terminate that person on COBRA. Brings us to the end of our COBRA discussion, and I'd like to ask if anybody has any questions that we haven't answered yet, or if you have any questions about things that have come up in the past you'd like to discuss.
What if when the employer loses their coverage and so does the COBRA recipient at that time? What if they reinstate their coverage through the company, or they get a different policy or a different insurance?
That would be a discussion that the former employee would have to have with the employer and the insurance carrier at that time. There's no obligation to get them started, but if the employer, as a good faith measure, wants to have that person put back on the plan, that is a discussion that would be had at that time.
So if it's just that they're switching carriers January 1st and everyone's plan switches over, do you have to switch the COBRA employee over to the new plan?
Is contingent upon whether or not the employee wants to take it, but they have to be offered the ability.
Okay.
So it's a situation if, like I said, if they're going from Blue Cross HMO to Kaiser HMO, they're doing that for all the employees at the office, they have to do that for the COBRA members. So the COBRA member has to decide, well, do I want to go with that insurance plan or not? And they decide yes, then they have to be given that plan. If they decide no, then they don't have to take that plan and will have to be on their own for insurance and can thus look for an individual plan, for example.
I don't think we have any more questions.
Okay, folks, if that's the case and there are no more questions, I will again thank you for joining us today. We appreciate that, that you've taken time to talk about the things that we do every day. Please feel free to contact me. Blair and Aaron have my phone number, my email. You're welcome to ask me questions you might have about our situation here and our products. And again, Katie Bryan will be up there to see you folks in the immediate future to provide additional information. I can't think of anything else I want to add. So thanks again. Have a good holiday season. We are certainly looking forward to working with you folks in this product and project. Let us know if there's anything that we can do for you, okay?
Okay.
Thank you.
Thanks, folks. Have a good one.
No.